So back again here with implants. Last time I showed you a wall board when I was putting a molly bolt or the wall anchor into it and described what an implant was. So here I want to show you a little bit more of what a real implant kind of looks like. So here's a piece of jawbone. It's fake jawbone, of course. And I got some little implant stuff already done on here, which I'll show you in a minute what we're doing. This is an implant. This little screw like this here. And that's what goes right here. It goes right into your bone. The bone then takes 3 months to heal into the implant itself. Bone grows all around it, stops from rotating out, and then we can eventually get a crown on top of it. So everybody says, well, what's the implant? They think it's the implant, the tooth itself. No, it's not. The tooth goes on afterwards. That's the restoration. So here's 3 different components that are here. The first one is the implant. As we do the work, we go along and we drill a hole into the bone. Here's the hole. It's drilled in, also known as an osteotomy. So we drill the hole here, and we remove our implant right off of here, which has a little transfer on top of it. Put that right there. And like I said last time, the tools that we use are some of them, crank right down. So we crank this guy right down like so. And here's a little transfer that's on top. This is what's called a healing abutment. And then there's also a cover screw that goes on. So cranking these in, then we take an x-ray. And you can see up here, here's the x-ray that's over here. That's the implant that's down. This is one that's in with the transfer, the healing abutment on here. And then we also have one that has a custom abutment on top. So a lot of times people will also say, hey, you need a custom abutment because something's not fitting right or there's an angulation. So we have to make a special piece that goes on top rather than just screwing a crown down like we would normally do, which we like to do if we get an implant straight in. So I will take off my little transfer that's here. You get in here? We're going to unscrew this just like so. Wiggle a little bit. Wow, it's really in there. So the piece comes off, and there's my implant right inside there, at the bone level, similar to on this here. So now we place a piece over the top, which is called a cover screw, which allows this now to heal under in the bone, under the gum for about 3 months. If you didn't have it, if you were afraid someone was going to play with it, touch it, dislodge it, then you don't go with one of these guys here. This actually sculpts the tissue the way we want the tooth to look like it's growing right out of the tissue. So now I unscrew this here and show you what this thing looks like. This looks a little bit different here. So you can see that there's little angles on it and everything. It's supposed to mimic the way the tooth is going to, it sculpts the gum the way the tooth is going to actually grow right out of the bone. So this will be in here after we would do another surgery. We would actually then open it back up, place this, let it heal for about a week, and then we place our tooth on top or our custom abutment. That's this guy here. Custom abutment here looks very similar to a prep tooth for a crown. Let me show you guys here. I don't know if you can see that 100%. And then this gets screwed down. A lot of screwing with this stuff. And once it's locked into place, what we do is we go along, we will actually have a tooth made for this, and it'll sit on top and be cement retained. Don't particularly like cement retained, moving away from that, but sometimes you have no choice. So in this case, we would have a cement retained tooth on top, just like a crown over a prep tooth. This is what a prep tooth looks underneath. I'll show you. I'm going to come back now, and I'll show you exactly what a tie base or a screw retained crown is. I'll show you in a second another model that I have.